Thanks for staying with us on our Healthy Tuesday segment. We'll be discussing brain tumors, the types, symptoms, and causes. Joining us on the show now is a consultant neurosurgeon, head neurosurgeon, Lagos University Teaching Hospital, LUTH, also secretary of the Nigerian Academy of Neurological Surgeons, Dr. Tayo Ujo. Welcome to the show, sir.
Thank you for having me.
Thank you so much for joining us. We always hear stories of brain tumors. And some people, and when they find out, it's almost when it's almost too late. And I had an uncle who they never knew until it was really, really big. I mean, it was there, it was a really small mass. And it took a long time eventually for people to know that he took his life eventually. How do we identify the tumors? At what point is it malignant now, or is it benign? How do you know the difference? And what point do you feel you need to go to the doctor to see, to get it checked in the first place?
Well, thank you for that question. There are different types of brain tumors. There are the benign one. It's not a cancer. So the benign one will start gradually, and they can grow to a large extent before ever presenting with a symptom. On the other hand, the malignant one could start having symptoms within a few weeks. Now, there are also some types of tumor that are not primarily from the brain. What I mean by that is the brain cells itself could grow and become a tumor. On the other hand, there are other parts of the body like the breast, the lung, the liver, which may on their own have tumor, and the tumor can leave that part of the body and go to the brain. So we call that metastasis. So if I go back to where you started, for that type of patient who had tumor that grew to a very large extent before the patient knew, it's most likely going to be the benign tumor, which is not a cancerous one. How will somebody know that he or she has a tumor? For most cases, it will present with headache. And you know, many people would have headache because of what they do, where they've been, what they ate on, and things like that.
Exchange rate.
But the type of headache that will wake somebody up in the morning and probably get better during the day until it gets to the point that it's always there, needs to be checked. It might be the earlier presentation of brain tumor. Unlike the other type of headache that somebody will wake up very well in the morning, and as it gets busy during the day, the headache comes. So it is the reverse. The other thing that may show that there is a problem may be somebody who, well, let me divide it into two, children and adults. For children, a child that has been walking and is no longer walking, a child that has been talking and is no longer talking, a child that has been using both hands and suddenly is struggling to use one of the hands, it needs to be checked out. Then for the adult, there are different things that the brain controls. Actually, it controls virtually everything. So if any part of the body that has been working before has stopped working, like somebody seeing very well, now struggling to see, smelling very well, now losing the sense of smell, hearing very well, now struggling to hear from one ear or the other, that may be a very subtle way of showing that something is going on in the brain. The other way we can divide it is male and female. So men may present differently, women may present differently. But another very common way of presentation will be a very quiet person who is suddenly becoming aggressive. So there are so many ways a patient with brain tumor can present.
I was just wondering if there's ever a scenario where there might be a growth in the brain and it does not present any symptoms at all. maybe the person passes on and through autopsy you see it, are there tumors that people can live with their whole lives and it doesn't present any symptoms?
Actually, yes. So there are many people that would have brain tumor, they would never know, and the brain tumor will not kill them. A very typical one is what we call meningioma. It's a tumor from the membranes of the brain, like the tissue that envelopes the brain. And this meningioma grows so slowly that sometimes when we pick it, it's about 1 centimeter, we may be able to tell, well, this tumor would not kill. It may not even grow bigger in some instances, but there are some that it will suddenly balloon out, then the patient would need to be treated. There have been studies that had looked at patients that died from different other causes, and for different reasons, they had to have autopsy. And during autopsy, they found brain tumor, like the type I mentioned. And in that case, it never presented with any symptoms while the patient was alive. So it is very possible.
I had a friend who had breast cancer. She had it the first time, then the second time she got it. This one, they removed her breasts. But then the cancer came back in her brain. She died not long after the diagnosis, you know. She even died, it was like a week. Is that how cancer, it can just spread?
So I started then that there are two types. There is one that will grow very slowly. Somebody may never even present with it. And even when it is diagnosed for different reasons, sometimes you don't really have to treat it if it is not that big. But like the one you just mentioned, it started from the breast and went to the brain. It is called metastasis. Those ones are very dangerous. So whenever anybody has a tumor from any paired organs of the body, like the breast, like the lung, and if we extend it a little bit from liver and colon, we always watch out for brain metastasis. So for those people, we'll write it out to them. If you have a headache, please don't keep it. If you're sleeping too much, please don't keep it. If you're not seeing well, if there is any behavioral changes, you need to flag it. So for those type of people, even after the breast had been removed, the metastasis to the brain could still be a very significant issue to look out for, unfortunately.
So, doctor, what are the causes of this tumor? Is there any way that we can avoid having some of these things happen?
So again, there are two types. There's a primary brain tumor, which means that the tumor originates from the brain. There's virtually nothing we can do. The tumor is coming not because of what the patient had done or didn't do. It's just sporadic. For some others originating from other parts of the body, the breast, the lungs, the liver, and so on and so forth, well, there have been instances where you may be able to prevent it, or if you're not talking about prevention, picking it up early. The reason is, if the diagnosis is made early, for instance, somebody with a breast cancer, and that is quickly sorted out, the chances of metastasis to the brain might be reduced. For lung cancer, there are so many health awareness issues, how to make sure nobody gets that. And if that doesn't happen, then it won't get to the brain. So it's not clearly defined.
What you can do or what you cannot do.
But for the primary one, there's absolutely nothing anybody can do.
I saw a little child, a little girl, I think about 10 or so years old, and many years before, when she was about 5 years old, I saw like behind her ears at the back here, it's a little small growth, really tiny growth. And I told her mom, and she said, "Oh, we just looked over it. It wasn't a big deal." And I saw her after, I'm not saying in a long time, I saw her about 5 years recently, and it has almost grown to a little coin now, and it's a bit bigger. And I told her, I think you need to get this checked, because I remember seeing this thing many years ago, and it was just like a little dot. So it's just like a small growth. Can that be a tumor, or can it just be something that is growing? That's something inside.
Well, it's difficult to tell.
Right.
If it's on the skin and it has been there for like 5 years, or the time frame you mentioned, it's probably not a tumor.
Okay.
Because for a tumor, that period is too long to be a catastrophe.
Yeah. Okay.
So I saw recently a lady who had had tumors taken out of her head. I was surprised that it has called to change shape. Like, can they grow that big, or is there some sort of something happens with the skull. So she now had she had regular head. After a while, the cancer had grown and then the shape of her head had changed.
There are many reasons for that. There are some tumors, once you remove them, they're never going to grow back.
Okay.
Like those that are benign, they're not cancer. There are some that even after you've done everything you should do, you've taken the tumor out, you've done chemotherapy, you've done radiotherapy, they will grow back. And when that happens, it will affect the skull, like you mentioned. On the other hand, there are some that are actually coming from the skull itself. So for those types, you may have to take the part of the cranium, the part of the skull out. And you know, it would never be as smooth as if nobody ever touched it. So any of those would be the
May have been
reason.
the operation that caused the change in the shape of the skull.
It is possible. It is also possible that the tumor is growing back and is growing into the skull.
This is would be a difficult question for you because a lot of people now are going towards alternative medicine because they feel that your kind of medicine is too invasive, expensive, invasive, and it doesn't always bring a cure. Because you do it, the thing will grow back. Or what do you think about that?
I think a lot of awareness needs to go out there. What you just painted is not always the case. We have had patients that were operated years ago and the tumor completely gone, not growing back. On the other hand, there were some that, like I mentioned earlier on, the tumor will grow back. We may have to go back again and again. On the issue of the alternate approach to healthcare, what I can say clearly is that for the orthodox one, for which I've been doing for a while, we have publications, we have documentations, we know what to do, and so on and so forth. For the other side, I will struggle to talk much about that because it's, one, not my field, and two, I don't have the evidence that somebody had breast cancer, had metastasis to the brain, took some medications, and it disappeared. We don't have the pre-op or pre-treatment images and post-op images that show that it is cleared. But on my own side, we can document, we can show the picture. Oh, this was the tumor 5 years ago. Now there's no tumor. And 5 years later, you can see that it is not growing.
Doctor, in our country, when you complain to a doctor that I have headache, repeated headache, they just give you paracetamol or something to use, and or they'll increase to ibuprofen or something. At what point does somebody know I have to go see a neurosurgeon? At what point do I request to get a referral to a neurosurgeon? Because half the time you're just treating headaches and severe headaches and migraine, and you just think malaria or something. You know, you just keep treating this and it never goes away.
And I think that's a very important question, actually. You know, there's this saying that if it doesn't go after 3 days, you should see your doctor. So if somebody has a headache that has been treated for like a week or two, and rather than getting better, it's getting worse, such a patient should see a doctor. And I've had people that would say on their own, we've been on this for a long time, doctor, please, can I have a CT scan? And we find something. So if the patient has been treated, or if the person has been managed and the symptom is not getting better, you should get a scan of the brain. And that has been the feelings that I get when I see patients with a very big mass in the brain. They will tell me they have been seeing a doctor for the past few years. So it wasn't their fault, but it's also possible that, well, the cost of imaging is not within reach for them, and they struggle with that. But anybody who has any of these symptoms, particularly seizure, and this is important because I give a talk sometimes, and somebody had been having seizure, and when she had that talk, he decided to go and have her brain scanned, and she found out that she has a tumor. So seizures, headache, loss of vision, you should get a scan. You know, it's actually better to get a negative report that, okay, I did it. there was nothing there.
Yeah.
Gives you peace
Than
of mind.
not to do it,
all.
and 5 years ago found a tumor. And I must say it here, when a tumor is very small, it is possible to get a cure. When it is very large, then it may be a very big struggle.
Okay,
That
I
was
want
going
to
to be my
find
next question, actually.
I want to know about the process of taking it out, the surgery itself. And we know that with technology, there are less invasive, more improved methods. And so for many of us, we're just scared that they're going to cut my hair. If they remove my skull, that means I'm dead. Are there new methods that can encourage people to do a proper investigation?
You know, years ago, many people will refuse surgery because they were told that once the head is opened, they were never going to be the same.
Yeah.
But that was 20 years ago. Right now, the technology has gone to an extent that even after the brain tumor, it will be difficult for somebody to see the person and say, oh, you've had a brain tumor. The opening is smaller. There is enough technology to ensure safety so that we don't cut what we shouldn't cut. We've got a microscope that magnifies tissues up to 10 times.
Wow.
So you will know this is a brain tissue, this is a tumor, this is a blood vessel. Because in taking out the brain tumor, you really don't want to cut the blood vessels. Otherwise, there'll be a stroke.
Right.
You really don't want to injure the nerves. Otherwise, there'll be terrible sequelae. So the technology has moved from what used to happen 20 years ago, where you use your naked eye, you use something big to cut the head, and the sky is among us, and everybody is scared. Till now that you can do it, and without 3 or 4 days, everybody is fine. Patient goes home, doctor goes to sleep. I must say that the earlier the diagnosis is made, the better for the patient. The sooner, the better. The sooner the surgery is done, the better for the patient as well. And it is relatively safe.
So how do you handle the after surgery care for the patients?
Well, when it comes to surgery, it's not you touch and go. The patient is going to be with you for some time.
Okay.
So after the and it's also not a one-man show, I must say. The surgeon is there. The anesthetist that will put the patient to sleep and wake the patient up will be there. Very important too, the nursing services.
Yes.
Because somebody will be looking after the patient when the doctor goes away. So once the surgery is done, it stays in ICU, which is the intensive care unit, where there will be doctors, nurses, and everybody. And there will be a step down to the ward, and it will still be monitored. And even after that, there will be need for follow-up.
Are there situations where you can have surgery while you're still awake? Surgery while you're still...
Oh, actually, yes, it's been done. It's called the awake surgery. And there are indications for that. Different parts of the brain have different functions. Yeah. And there are some parts of the brain that will not actually tolerate any fiddling around. So you really want to know that you're not hurting the patient more. For instance, we call it the motor strip, the one we use to move. So at the time of surgery, you wake the patient up. Oh, can you move your hand? I can move it, and you can do a little bit more. Oh, can you move your hand? It's getting a bit weaker. Okay, then you stop, then you go elsewhere. But there are other facilities now, or equipment now, that we can use rather than doing that.
We have to wrap up, unfortunately. I have to run, but thank you very much, Doctor.
You're welcome.
I'm happy that so you're one of those that moved home, right? To come and work in Nigeria.
You're not going back.
You're not Japaning again. You're back now.
He's not.
He's not responding.
Oh my goodness.
Consultant, come and go.
Yes, you can call
But
him.
thank you. We just like to see Nigerian doctors in Nigeria. And
Thank
it's
you
good
very
to
much.
have you.
Yes, sir.
That's all we can take on today's show. Have a great day. We'll see you tomorrow. Bye for now.
Thank you.
Yes, sir.